Another woman with glasses here in the third row.
My name is Jess Reeves and I'm from the National Deaf Children's Society. I was contacted in just the last couple of days by my colleagues in our Scottish and Welsh offices with a very specific question for you, Maria, which was, we understand that the single assessment as set out in the Special Educational Needs and Disabilities Green Paper for the new education, health and care plans, which are for young people with special educational needs and disabilities up to the age of 25, that the government are planning to look at using evidence from these in assessment for disability living allowance. And we're just wondering how that's going to work, as welfare is a UK-wide policy area, and obviously education is not.
Thank you very much. And then the lady a bit further back with glasses on the end of that row.
Hello, yes, good afternoon. My name is Susie Rollins, Welfare Benefits Coordinator for Merton Council. My question is regarding welfare benefit advisors like myself. What is your view regarding the fact that we are all experiencing major cutbacks in our services, which means in turn that people with disabilities will have a great drop in representation and ability to access their entitlements to benefits, especially with the introduction of new ways of applying, such as online facilities rather than face-to-face?
We'll take one more. I think there's a gentleman who's had his hand up for some time over towards the window with a scarf on. Sorry to give you some exercise across the room.
It's all right, I make it.
Hi there, Jamie Hewitt, Government Affairs Manager at the National Rheumatoid Arthritis Society. Just to say, very pleased to hear that you've been chatting to your colleague Paul Burstow about the health linkages. I think that's something really important. My charity is campaigning very hard actually around the issue of early diagnosis and starting people on appropriate treatment early. We know that if you could get the period down to within 12 weeks, you can really dramatically improve the clinical outcomes for people, and therefore more of them can contemplate a return to work. So my question to you is, have you had other conversations beyond talking to Tim about carers and so on, about the importance of early diagnosis and starting a treatment and the cost savings that could generate? So has there been any discussions about research perhaps into that area in those linkages? Thank you.
Well, starting off with Jess's comment about the importance of the single assessment and the issues that we face now having devolved administrations. And you're right to raise that. But taking a step back, I think it is important that we try and help particularly parents who've got situations where their children will be facing multiple assessments. How do we try and make that easier for the parents, but also, much more importantly, for the children as well? So having read across in some way, shape or form, I think is important, and I quite deliberately made sure that we didn't come forward with a new way of delivering DLA to children until we could segue it into the work that's being done around the single assessment more broadly, particularly around special educational needs. We will work really closely with the devolved administrations to make sure that this works in a streamlined way, whether you're in Scotland, Wales, or indeed Northern Ireland. And that will be an important part of the work as we move forward. I was in Northern Ireland last week talking about these sorts of issues. So, these are the sorts of things that we are already trying to tackle head on. But you're right that it's important that it works well for parents wherever they live in the United Kingdom. But we have to respect the fact that in devolved administrations, these sorts of matters to do with education are the responsibility of the local assemblies. In terms of Susie's comment about Merton, can't remember where Susie was sitting now, about there. I hear what you're saying, but I seem to recall, actually, Scope did their report recently, didn't they, about how do you do, difficult times, how do we do things better? And all of us are, have challenges fiscally, have challenges financially. How do we make sure that we face those challenges well? I think the Scope report, for anybody who hasn't read it yet, it's good reading, says that different organisations who, local governments who've had financial challenges, not everybody's reacted in the same way. Different councils have perhaps gone down the salami slicing route and just shaved things off. Other councils are seeing this as a challenge to really reconfigure the way they deliver services and make sure that they get the services that disabled people still need. And I seem to recall Merton did quite well in that, actually. So I was looking down the list of authorities who really, gone the extra mile and seen how they could keep that quality of service even though finances were tight. So it's about doing things better, and particularly when you're right, when we're trying to do things in a more streamlined manner through online applications rather than necessarily everything being face-to-face. Jamie, you raised the issue of particularly early diagnosis. And of course, you're absolutely right that supporting early diagnosis, whether it's in the field of rheumatoid arthritis or anything else, and particularly with children, is absolutely critical. I have to say that my conversations with my health colleagues on this haven't been extensive, but you've prompted me into taking some action on that, and so I can take that up with them directly. Thank you.